So my name is Eric Honda. I'm with the Department of Health. As far as the question on how many vector control staff we have here on island, we currently have 6 positions. 5 are filled. We're currently having interviews for the 6th position here. We have just gotten approval from the governor for an additional 8 exempt positions, vector control positions, which currently is at the administrative level being approved right now.
Thank you. My next question was Waipi'o. I know we had a testifier, concerned about Waipi'o, and with the taro and the standing water. Can you give a brief overview of what's been happening and what are the next steps for Waipi'o?
Sure. If you don't mind, I'd just like to add a little bit more to what Eric shared, and that is within the local Department of Health staff, they've also been tapping into other branches within Department of Health locally, such as the sanitarians, to help provide that vector support. Why it's important to share that is that we have heard concerns raised about how we may be spreading the Department of Health's team very thin, and where that relates to the sanitarians is these are the same personnel that do your food establishment inspections and so forth. But to date, again, when we meet, we discuss the various branches are able to keep up with their routine work as well as to support vector, and that's how they've been making it happen. But specifically to your question with Waipi'o Valley, we had a community meeting this past Monday, and it was to update the community where we're at with the outbreak in the valley. The last date of onset of an illness there that we have confirmed is February 1st. So with each day going by, it's looking more and more promising that we could consider the reopening or lifting of the restricted access with Waipi'o. The reason why we implemented the restricted access is there was sufficient evidence to indicate that there was a point of exposure or a source in the valley, which meant if we allow people to continue to enter the valley, we were at risk of people bringing the virus out, contracting it, and taking it elsewhere across the island, or if it's visitors, taking it anywhere they're going to go. So we needed to restrict the access to reduce the risk with continued spread of the dengue virus. Now, we've had several cases associated with Waipi'o Valley, and these are likely, and I say highly probable, confirmed contact and transmission in the valley. And again, that's what supported the decision. Hearing the community's frustrations with, the initial restricted access was one of requesting volunteer compliance. We needed everybody to do their part, rather than take a very hard line in putting law enforcement there. By that, unfortunately, as of Monday, we're hearing the complaints and the frustration. And because we're so close to considering Waipi'o as low risk, as of today, we have police officers there manning the guard or the entry point and restricting access to residents and the farm and farm workers only. And it's necessary to get past this point to allow for, again, us to consider that the valley is no longer a risk for a point of infection and allow the community to return to some normalcy. As we shared with the business owners, such as Mr. Matsuo, can truly appreciate the impact this is having, not just on the operators in Waipi'o, but the Honoka'a community at large. Hearing from some of the businesses, the business activity has dropped off significantly just with the mention of restricting the access. But unfortunately, there's still visitors and others making access and not heeding the advice and request to not enter the valley.
Very appreciative that had happened because it gave time for Waipi'o to breathe again and to rejuvenate itself from all of the, some of the traffic that they were having in the valley. So that has helped. I know that shouldn't be the reason, but the other side of it was they were appreciative of that. The other thing that I just wanted to make known even to the Department of Health is that there are a lot of cases that go unreported. So the numbers, even if we say it's February 1st or whatever, I've gotten calls about people and concerned about their neighbors and not wanting to report it because no sense go to the doctor because it's flu-like symptoms. There is no vaccine. That you can waste your time. You got to go doctor. No more insurance. You got to pay for something when they're going to just send you home because it's just like a flu-like symptom. My concern to them was that the rat lung worm disease, or has basically flu-like symptoms also. So I'm saying go check, because you don't know if it's one or the other, because since we did away with vector control, we've had so much of the rat infestation in a lot of communities, because you don't have the sugarcane fields burning anymore. That was kind of like our vector control in a way, and since now sugarcane is gone, it's crazy. I'm not saying that the rats are in our sugar, but we know what was happening back then, and then that department got cut because I think things are getting better and not as out of control. So I'm glad to hear that vector control and the funding that I think just passed third reading from the Ways and Means Committee to fund more vector control, and I hope they concentrate those efforts on this island first, and go forward from there. So thank you so much for being out. I'm sorry I couldn't make the Waipi'o meeting. Thank you so much for being there, even with Kanani, for all your help that we've needed out in the community, and Department of Health for all you're continuing to do for us. Thank you.
Could I just add, and again, thank you for the comment about why people should get checked. As you pointed out, there are many other illnesses with high probability of bad outcomes if they choose not to go get checked and confirm. So we shouldn't self-diagnose, one. It's important that we know where these cases are so we can feel comfortable that the risk is going down, especially if it's ruled out that it's not a dengue case. And we're hearing the frustrations yet of people unable to access the testing, access healthcare. Again, as a safety net, you've heard the mayor and you've heard myself share that if people are stuck and they have no access to healthcare, don't know where to go, they can still reach out through the 911 system to EMS, because at least it allows them to get checked to make sure it isn't something life-threatening or potentially life-threatening. And through that process, the ambulance might come out and, again, recommend that you go in and get checked, because they can't confirm in the field whether you have dengue. They can say, yeah, you have a lot of the symptoms, but you could have something else. But it gets you into the system, gets you checked, gives you access to health care. Places like our community health centers, Hamakua in particular, said they're not going to turn anyone away for inability to pay. And really commend that organization and the outreach and what they're doing.
Yeah. So, and I'm glad you mentioned that with Hamakua Health Center, because they're an FQHC. So every federally qualified health center, their target population is Medicare, Medicaid, and especially the uninsured. So you have Bay Clinic in Hilo, you have Hamakua Health Center, you have Kohala Health Center, you have the West Hawaii Community Health Center. Those are all FQHCs, and I would say go to them. And I think they have not an FQHC, but something else in the Puna side, that health center also. So there's a lot of places that can take uninsured. So I'm hoping people will take advantage of that opportunity if they do feel sick. And it doesn't only have to be about this dengue stuff. It can be basically anything. Okay, thank you. Thank you so much.
Thank you.